Hello and good evening to all of you. So welcome to this session of recall questions. So recall question FMG July 2023 exam. So myself Dr. Saurabh Bhatia and I'm your pharmacology guru. So here I would be discussing these questions with you which were asked in the exam. So I have total feedback of around 23 questions. So as per the feedback which I've got from the students, there are total 23 questions which are asked this time in your FMG exam. Now, if I assess the level of this question, I would say the questions are of, standard types, which are usually asked in FMG exam. So they are not very tough and also, but they will not very straightforward and very easy. So I would say these days there's a trend to ask such type of questions where they want to assess your practicality of the knowledge. So you have knowledge of pharmacology and how to use them practically. There are some few clinical questions. So how you have to use that knowledge clinically also. And there are some fact-based questions. So overall, the level is medium. It's not very hard, not very easy. Any student who must have attended our lectures, any students who have attended our lectures must have been solved these questions in exam. So that student will be able to get easily more than 60-70% marks in the exam. So I am there with you guys in on YouTube also. In case I would display the question, and I'm pretty sure that my all options will not be the same which were asked in your exam. So I want your help also. So I would display the question, and uh, you people have to give me the feedback also, like uh, right, keep which what are the other options which are asked in the exam. Okay. My all options. Thanks for China. So you are from China, Dr. Sailing Best, and Dr. Kauma. Dr. Kauma is from Zambia. So question number one was based on cisplatin induced side effects, right? So I have so many times emphasized on this drug cisplatin. So cisplatin is one of the very important drug for FMG topic. So during our review session also, I have emphasized on the cisplatin side effect. So this time they have asked the most common side effect of cisplatin. So any idea what's the answer? Which is the most common side effect of cisplatin? Cisplatin induced most common side effect is, anyone would like to answer over here? So I'm with you on the YouTube. So I'm just waiting for your reply. Yes, Dr. Anas Zahir, good evening. Dr. Anas Zahir, good evening. Yeah. Dr. Medico, Dr. Manju Medico, Dr. Geeta, good evening. Anyone would like to answer? What is the most common side effect of cisplatin? Most common side effect of cisplatin. Anyone would like to answer? Okay, yes. So Dr. Muhammad Shahbaz has answered this question. It's a GIT symptoms. So GIT symptom is the most common side effect to cisplatin. So guys, cisplatin is one of the very important drugs. So please remember, cisplatin most common side effect is GIT toxicity. So GIT toxicity is the most common side effect of cisplatin, which can result in nausea, vomiting, and diarrhea. And we have covered so many times during our lecture that maximum risk of nausea, vomiting, maximum risk of chemotherapy induced nausea vomiting is associated with cisplatin. So cisplatin will cause maximum risk of nausea and vomiting. Yes, now more students have joined us. Dr. Beshali Ghosh has joined. Very good answer, Doctor. GIT symptoms is a side effect. Dr. Hamish Nimberg has given the answer. Dr. Ovish Ashraf from Bangladesh has joined us. So most common side effect is GIT toxicity. Now, if the question is not on the most common side effect, if the question is based on second most common side effect. So second most common side effect would be nephrotoxicity. Although it's not mentioned in the MCQ, but nephrotoxicity is the second most common side effect of cisplatin. Now, whenever a drug will damage a kidney, whenever a drug will cause nephrotoxicity as a side effect, guys, please remember always the medicines results in tubular necrosis. So tubular necrosis, these medicines will damage the kidney tubules. So during elimination through urine, these medicines will damage the kidney tubules. And because these medicines will damage the kidney tubules, these medicines can cause loss of ions from the body, right? So second most common side effect of cisplatin is nephrotoxicity that will result in loss of potassium and magnesium out of the body. And when this potassium and magnesium are lost out of the body, this will result in nerve conduction disturbances. This will cause neurotoxicity as a side effect. So medicine will cause neurotoxicity as a side effect of this medicine. So drug side effect is neurotoxicity as a loss of electrolytes. So electrolytes are lost, this will cause neurotoxicity and can also result in ototoxicity as a side effect. So guys, please remember, whenever the kidney is affected, ions are lost. When the ions are lost, nerve conduction get disturbed. When the nerve conduction get disturbed, patient can have sensory neurotoxicity. And one of the very special sensory nerve is eighth nerve. So eighth nerve will not be able to fire properly. Now, this can be asked to you in exam that which medicine is best drug to prevent this nephrotoxicity. So to prevent the cisplatin induced nephrotoxicity, we can use a medicine amifostin. So amifostin is a drug that I can use to prevent this nephrotoxicity. So amifostin is given to prevent the side effect. We call it nephrotoxicity caused by cisplatin. Now, apart from that, cisplatin can also cause bone marrow suppression. So myelosuppression is a third side effect that you must keep in your mind regarding the cisplatin. So cisplatin is a drug, most common side effect GI toxicity. Question number 1, answer is A. Now let's display the second question. A patient is chronic alcoholic. So there was a history of chronic alcoholic patient. There was a history of chronic alcoholic patient, and that patient has come to us with confusion and symptoms related to Wernicke's encephalopathy. So I don't know which symptoms are given. So as per the feedback which I have got from the students said like, sir, patient ka symptoms resembling encephalopathy. So patient was having confusion. Patient were having the symptoms resembling the encephalopathy. Plus patient is also having this aphasia and ataxia. So unstable gait might be due to ataxia or might be due to ophthalmoplegia. So because of ophthalmoplegia, this unstable gait might be there, right? So this chronic alcoholic patient, guys, you must be knowing this is due to a deficiency of anyone. Dr. Anas Zahir has already mentioned the answer. Anas Zahir, your answer is correct. Right, so this is a typical presentation of vitamin B1 deficiency. That's a thiamine deficiency. So whenever any patient who is chronic alcoholic, anyone who is chronic alcoholic, and that patient comes to you with the CNS kind of symptoms, so patient will come to you with gait disturbances, ophthalmoplegia, ataxia, aphasia. All these symptoms resemble vitamin B1 deficiency. So alcoholic patient can develop encephalopathy. We call it Wernicke's encephalopathy. Can develop. Very good. Symptoms are GOA symptoms. GOAV is a mnemonic to remember these symptoms. So patient can have Korsakoff psychosis. Patient can have Wernicke's encephalopathy symptoms. It's typical due to vitamin B1 deficiency. Guys, anyone who is alcoholic, this patient will start getting energy with this alcohol intake. And when the patient will start taking energy from alcohol intake, that patient will start neglecting the normal diet. So if the patient will start getting ATPs or energy from the alcohol only, that patient will start neglecting the food and patient develops vitamin deficiencies. So vitamin B1 deficiency is most common deficiency associated with alcohol. Okay, which should be started initially? The question was which drug should be started initially? So vitamin B1 can be given. So vitamin B1 can be given to this patient. If these were the four options, the best answer is vitamin B1. In case you have anything in your mind, please guys mention over here in YouTube. I'm there with you on YouTube as a live. Right? So live chat is there on the YouTube. So link is shared with you everywhere. So vitamin B1 is the most appropriate answer out of these four options. If there is any other options, please let me know. Now let's move on to question number 3, antidote of benzodiazepine. Now this paper is full of antidotes. So guys, these are the very simple, straightforward questions. So we have discussed so many times during our lecture. So benzodiazepine, antidote of choices. Anyone would like to answer here? What is the antidote of benzodiazepine? So antidote of benzodiazepine, what is the answer? Anyone would like to answer? Yes, Mohammed Shabazz, Dr. Jibin, Beshali, Dr. Hamesh, anyone would like to answer here? What is the antidote of benzodiazepine? What did you mark, guys? What do you mark in the exam? Yes, answer is Dr. Manju Medico has answered. No, Dr. Manju Medico, it's not naltrexone. It's something else. Answer is flumazenil. Yes, Dr. Rajesh, Dr. Jibin has answered correctly. Answer is flumazenil. So flumazenil is an antidote of benzodiazepine poisoning. So guys, this question is based on antidotes of drugs, right? So please remember some important antidotes. Like they can ask you how to treat amphetamine toxicity. So if I say amphetamine toxicity, so for amphetamine toxicity, the best treatment is forced acidic diuresis. So I'm discussing some important drugs and their treatment of choice. So forced acidic diuresis is the treatment of choice for amphetamine toxicity. Second, they can ask you benzodiazepine toxicity. So benzodiazepine toxicity, the antidote of choice is flumazenil. So flumazenil is a competitive antidote of benzodiazepine. Second, they can ask you beta blocker toxicity. So beta blocker toxicity, guys, you people are supposed to mark glucagon. So glucagon is the antidote of beta blocker toxicity. Next is calcium channel blocker toxicity. Now for calcium channel blocker toxicity, calcium gluconate. So calcium gluconate is the antidote of choice. So calcium channel blocker, calcium gluconate is antidote of choice. Next, they can ask you digoxin. So digoxin toxicity. So digoxin toxicity, you have to mark digibind. So digibind is the antidote of choice. And the last is opioid toxicity. So in opioid toxicity, naloxone is the important antidote. So naloxone is the important antidote which can be given to a patient. So these are the important drugs for your exam. So the mnemonic is A, B, C, D, O. So these are the 5 or 6 medicines where hemodialysis cannot be done, and there the antidotes are important to know. So amphetamine toxicity, benzodiazepine toxicity, beta blocker toxicity, calcium channel blocker, digoxin, and opioid. You can add on one more medicine here in the list, medicines which are tricyclic antidepressants. So tricyclic antidepressant medicines toxicity, the antidote of choice is sodium bicarbonate. So sodium bicarbonate is the antidote of choice is sodium bicarbonate. Yes, Dr. Shabas, we discussed benzodiazepine so many times during our lecture. We made a mnemonic, maze ko nil karna hai. So this medicine will make your maza nil. Mazenil, flumazenil is the antidote of benzodiazepine toxicity. In this MCQ, naloxone is opioid antidote. It's a opioid antidote, and fomepizole is a drug. Fomepizole is a medicine that is given for methanol toxicity. Fomepizole is given for methanol toxicity. So question number 3, answer is A. Now let's move on to question number 4. Now this is a TB drug. So bedaquiline we have discussed in our review lecture also. So bedaquiline is a new medicine. It's a tuberculosis drug. So bedaquiline mechanism of action is, anyone would like to answer? Bedaquiline ka mechanism of action they have asked this time. And they have also asked whether this drug is bacteriostatic or bactericidal. Whether this medicine is bacteriostatic or cidal, anyone would like to answer? So bedaquiline is a TB drug. This medicine is given for MDR TB as well as for HDR TB. So it's a ATP synthase inhibitor. This drug is ATP synthase inhibitor. So medicine is ATP synthase inhibitor, and it's a bactericidal medicine. It's a bactericidal drug that we use for tuberculosis. So guys, remember I told you in my review lecture also, which I took here in eGurukul. So two medicines, one is bedaquiline. These are the important drugs for your exam. So one is bedaquiline, second is delamanid. So bedaquiline, delamanid, and one more is pretomanid. So these are the new drugs for tuberculosis. So bedaquiline, delamanid, pretomanid are new drugs for tuberculosis. Now out of this, bedaquiline is ATP synthase inhibitor. It's a ATP synthase inhibitor. Maybe next exam they will ask you the side effect of this medicine. So the important side effect of this medicine is QT prolongation. One of the important side effect is QT prolongation. And whenever we give bedaquiline to a patient, we have to monitor the patient ECG. Now, all these recommendations are given in your national program. Like in our India National TB program, this is given in our national program that bedaquiline is ATP synthase inhibitor. This medicine can cause QT prolongation and we have to monitor the patient ECG. Now, delamanid and pretomanid, these medicines are cell wall inhibitor. These drugs are cell wall inhibitor. So they are inhibitor of mycolic acid synthesis. So they are inhibitor of mycolic acid synthesis. So guys, please remember, TB bacteria is a mycobacteria, and the special thing which is present in the cell wall is mycolic acid, right? So mycolic acid synthesis inhibitors are delamanid and pretomanid. Bedaquiline is ATP synthase inhibitor. Yes, doctor. Dr. Shabazz, one option was MA. MA means, I think, doctor, you want to say mycolic acid. But it's a mycolic acid synthesis inhibitor. That is delamanid, pretomanid, so new medicines. And bedaquiline is ATP synthase inhibitor. It's a bactericidal drug. Even these medicines are also bactericidal. These medicines are also bactericidal given for tuberculosis. So question number 4, answer is A. Now let's move on to question number 5. Now this question is asked after so many years regarding the pheochromocytoma. So pheochromocytoma, we have made a mnemonic that the drug is phenoxybenzamine. So pheochromocytoma patient can have excess of noradrenaline and adrenaline. So patient will have excess of noradrenaline and adrenaline that will result in hypertension crisis. That will result in hypertension crisis, and they have asked which medicine is given. Which medicine is given as a drug of choice? So phenoxybenzamine. So phenoxybenzamine, we made a mnemonic during our lecture also, that drug which is phenoxybenzamine having the word ban. So this medicine will ban the alpha 1 and alpha 2 receptor. So this is a irreversible alpha 1 and alpha 2 blocker. So why we say that medicine will ban something? Because the medicine is having the word ban. So this medicine will ban the alpha 1 alpha 2 receptor. It's a irreversible blocker. So this medicine is irreversible blocker of alpha 1 alpha 2 receptor. Action lasts for long time. It's the best medicine for hypertension crisis in pre-operative stages. So in pre-operative stages for pheochromocytoma, phenoxybenzamine is the best medicine to be marked, right? But during surgery, now during the pheochromocytoma surgery, so during the surgery of pheochromocytoma, then which medicine you will mark for hypertension crisis? Now this year they have asked you pre-operative stage. Maybe during next year they will ask you, next exam they will ask you which medicine is used in for intraoperative hypertension crisis. Next exam, they can ask you intraoperative hypertension crisis, or during surgery, if the BP will increase, which medicine you will mark as a drug of choice. So here the answer is nitroprusside. So sodium nitroprusside is the best medicine to be marked for intraoperative hypertension crisis. For intraoperative hypertension crisis, next exam, you can mark nitroprusside as a drug of choice. Right? Guys, please remember, whenever we give nitroprusside to a patient, this medicine can cause cyanide toxicity. So during nitroprusside infusion, patient can develop cyanide toxicity as a side effect. So nitroprusside can cause cyanide toxicity as a side effect, and we have to give an antidote. And the antidote of cyanide toxicity is hydroxycobalamin. So during our lecture, we have made a mnemonic that cyanocobalamin or hydroxycobalamin is almost same thing. So cyanocobalamin is given as a best antidote of cyanide poisoning. So cyanide toxicity, we can give hydroxycobalamin. So during surgery, intraoperative crisis, we give nitroprusside. Side effect is cyanide toxicity. Antidote of choice is cyanocobalamin or hydroxycobalamin. But pre-operative stages, phenoxybenzamine is given. Now, Dr. Shahbaz is saying, sir, phenoxybenzamine was not mentioned, uh, but there was some other drug. Doctor, was there phentolamine? Was there as a drug, like other medicines can be phentolamine? So phentolamine was there or not there? Prazosin was there or not there? So these were the other options which might be there. Phentolamine, prazosin, or maybe one more drug which may be there, metyrosine. So any of the drug was there in the MCQ, please mention. If anyone has attended the paper, anyone have attempted the paper, given the paper, can any one of you tell me, instead of phenoxybenzamine, was there any other drug given in the MCQ? Was there any other drug out of these three? Phentolamine, prazosin, metyrosine? Anybody, anyone who is there, try to recall. Okay, so phentolamine was there. Yes, doctor, phentolamine, although not given in pre-operative stages, phentolamine, although not used in pre-operative stages, but it is used in intraoperative crisis. So, like if you ask me, sir, after nitroprusside, is there any other drug which I can use? So, during intraoperative crisis, I can use a medicine phentolamine. So, phentolamine, guys, is a drug which is not given by oral route. So, in pre-operative stages, this drug is not used. Phentolamine is not used in pre-operative stages. During surgery, yes, I can use this medicine, phentolamine. So, guys, try to recall this question. In case you find the proper option, just please send it to me here in the chat box, so that I will add on these options correctly, and accordingly I will find the best possible answer. Guys, was the question is actually based on pre-operative stage or intraoperative also? The question was actually based on only pre-operative, or was the question there on intraoperative crisis? So this is also confusion. If it is a pre-operative, answer cannot be phentolamine, right? But in these four, if these were the four options and phentolamine was there, you are bound to mark phentolamine. There's no other option. try to send me the options, right? So phentolamine is given by IV route, that is given in intraoperative crisis. Now these are the other two medicines which we can try in preoperative stages. These are the other two medicines like prazosin and metyrosine, which can be given in preoperative stages. Okay, now let's move on to the orphan drug. So they've asked the definition of orphan drug. So guys, what is orphan drug? So answer is orphan drug is the one that is given for the treatment of rare disorder. So orphan drug is the one which is given for a rare disorder. First definition. Second disorder, orphan drug is the one which is given for a major public health problem. So any drug which is discovered for major public health problem which is going on in the country. So any major public health problem going in the country at that particular point of time, right? So major public health problem ke liye, if a drug is discovered, that is an orphan drug. So orphan drug is given for major public health problem, or it is also a drug that is discovered for a rare disease. So these are two definitions for orphan drug, and any pharmaceutical company which will manufacture orphan drug can get a patent rights, or we also call it marketing rights, exclusive marketing rights for 10 years. So the company can get the patent rights or exclusive marketing rights for 10 years. So question number 6, answer is A, right? Yes, Dr. Manju Medico has given the correct answer. It's A. Orphan drug is given for rare disorder. It's a drug which is discovered for major health problem of a country. Now guys, what is the essential drug? So here I will give you one homework to find out what is essential drug. So one is orphan drug. What is essential drugs? So here you have to find out the answer. What is essential drug for a country? So guys, please remember, essential drug for a country is like the drug that will cater the major health problems of the country, and that should be available in country all the time at a proper cost, at a proper uh, in a proper amount. So drugs should be available in proper quantity, sufficient amount at all the time to cater the major health public problems of the country. This is the essential drug. So essential drug is not the one which is given for rare disease. Essential drug is a group of drugs. It's a group of drugs that is there in the country to cater most of the public health problems. Yes, Dr. Manju Medico. COVID vaccine, when we discovered, it was one of the example of rare disease. It's one of the example of orphan drug. So COVID vaccine is a type of a orphan drug that we discovered for the major public health problem, which was going in year 2020 and 2021. Okay, so according to Dr. Raj, this question was not there. Maybe Dr. Raj, this question might not be there, but this is what I have got from the students, the feedback I have got from the students. Now, question number 7, drug of choice for facial nerve palsy. So there was a one question based on facial nerve palsy, and they've asked the drug of choice for that. So what is the best drug for facial nerve palsy? So for facial nerve palsy, we always start our treatment with prednisolone. We always start our treatment with steroid, right? So in prednisolone is the best treatment. Now, if the patient is not controlled, patient disease is not controlled with steroid, that is prednisolone, then we put patient on acyclovir. As an antiviral drug. So we usually start our treatment with prednisolone. Disease is not controlled, we put patient on acyclovir, right? So guys, in case the patient is having severe disease, patient is having severe facial nerve palsy, then we start a combination of both together. So in severe disease, we start a combination of both together. So prednisolone plus acyclovir started together. So for facial nerve palsy, the first drug is prednisolone, the second drug is acyclovir. Question number 7, answer is C. So acyclovir is a drug, it's a DNA polymerase inhibitor, it's an antiviral drug. So question number 7, answer is C. Let's move on to question number 8. I don't know about this question. I'm not sure about question number 8. That is about the cheese reaction. So cheese reaction was actually asked in the exam or not, I don't know. So cheese reaction is a condition which is a type of hypertension crisis. So cheese reaction is a type of hypertension crisis. So it's a type of hypertension crisis, cheese reaction, right? Where the patient who consumes meat, tyramine containing food. So a patient will consume tyramine containing food. So tyramine containing food can be cheese. So tyramine containing food can be old and expired cheese, but it can be some wines also. It can be some beans also. So tyramine containing food if patient consume along with MAO inhibitors, along with drugs which are known as MAO inhibitor. So tyramine containing food if patient consume along with the drugs which are like MAO inhibitors. So MAO inhibitors will increase the level of noradrenaline in the body. So tyramine also release noradrenaline in the body. So tyramine releases noradrenaline in the body, and MAO inhibitors are the antidepressants. Apart from MAO inhibitors, we have SNRI. So what is the full form of SNRIs? We call them serotonin noradrenaline reuptake inhibitors. So they will also increase noradrenaline. So MAO inhibitors will increase noradrenaline. SNRIs will increase noradrenaline. Similarly, tricyclic antidepressants. Tricyclic antidepressants will also increase noradrenaline. So these medicines, when given along with tyramine containing food like cheese, this will result in cheese reaction or hypertension crisis. So the drug of choice here is phentolamine. So phentolamine is a medicine that is a drug of choice for this condition. And we people made a mnemonic during our lecture that whenever we consume cheese, we always consume Fenta. So Fenta is a name of a soft drink, which is an orange color soft drink. So along with Fenta, always consume cheese. So cheese and Fenta always consume together. So cheese reaction, best medicine is phentolamine. Answer is A. Now question number 9, they have asked question on bacterial vaginosis. So in bacterial vaginosis, which drug is not used? So which drug is not used as per the CDC recommendation? So as per the CDC recommendation, which drug is not used? So guys, for bacterial vaginosis, please remember drug of choice. Drug of choice is metronidazole. For bacterial vaginosis, drug of choice is metronidazole, but we can also use other medicines like tinidazole and clindamycin. So metronidazole, tinidazole, clindamycin are the three options that we can use. But please remember erythromycin. Erythromycin is a drug which is a narrow spectrum drug. That medicine is not effective against the bacteria responsible for bacterial vaginosis. So erythromycin is a narrow spectrum antibiotic, and because it's a narrow spectrum antibiotic, I cannot use this medicine against the gram negative bacteria, right, against the other bacteria which are responsible for bacterial vaginosis. So erythromycin is the answer of this question. Erythromycin is not given for bacterial vaginosis as per the CDC recommendation. Now let's move on to question number 10. So there was a question on postcoital drugs. So which drug is taken immediately after intercourse? So which postcoital drug is taken immediately after intercourse? So postcoital drug which is taken immediately after intercourse, the drug name is levonorgestrel. So levonorgestrel is taken total dose 1.5 milligram. So total dose of levonorgestrel is 1.5 milligram. So total dose is 1.5 milligram of this medicine. But if a female is not comfortable with 1.5 milligram, she can also take 0.75, 0.75. 0.75 milligram, 0.75 milligram with a gap of 12 hours. So with a gap of 12 hours, she can take 0.75, 0.75. But this total dose need to be taken within 72 hours. This total dose need to be taken within 72 hours. So postcoital drug that is used after intercourse is levonorgestrel. Now we have other options also like two or OCPs, two regular OCPs. Like we have the pills, Mala D pills, Mala N pills. So she can also take 2 plus 2 OCPs. So two regular OCPs like Mala D tablets, Mala N tablets plus 2 tablets, like 2 plus 2, total 4 tablets she is supposed to take. She is supposed to take 4 tablets of regular OCPs with a gap of 12 hours. So 2 plus 2 with a gap of 12 hours. This need to be again taken within 72 hours. So option 2 is incorrect. So she is supposed to take 4 OCPs, not 2 OCPs. So B option is incorrect. In B option, it's 2 OCPs given, but she is supposed to take 4 OCPs within 72 hours. Now, mifepristone is rarely used as a postcoital pill. So, mifepristone is rarely used as a postcoital pill. So, mifepristone, the dose is 200 milligram, which is given over here. Now, this dose is for MTP. This dose of mifepristone is for MTP. It's not for the postcoital drug. Now, being as a postcoital drug, I can use this medicine in a dose of like 10 milligram, 20 milligram, 50 milligram. I will not use this medicine in a dose of 200 milligram. So 200 milligram is a very high dose of mifepristone. This is meant for abortion, MTP, medical termination of pregnancy. This 200 milligram dose is not for your postcoital purpose, right? So mifepristone is, it can be used, but the dose given is wrong. Now ulipristal dose is 30 milligram. Ulipristal dose is 30 milligram, and this medicine is taken as a single tablet. It is also taken as a single stat tablet within 5 days of intercourse. So within 5 days of intercourse, patient is supposed to take 30 milligram of ulipristal. It's a most effective drug for postcoital purpose. So like levonorgestrel need to be taken within 72 hours. Ulipristal can be taken up till 5 days. So if I say out of these 4 medicines, the first 2 medicines can be taken up till 72 hours. The next 2 medicines can be taken next 2 medicines can be taken up till 5 days. So ulipristal, mifepristone can be taken up till 5 days. The first 2 medicines can be taken up till 3 days. So question number 10 answer is A. Levonorgestrel is the best answer to be marked over here. Right? So let's talk about the next question. So this live chat, I'm not getting your messages, guys. I'm not able to read the live chat, guys. There is some problem here. Anyways, I'll continue with the questions. Maybe after some time this live chat will start. Okay, let's move on to question number 11. So question number 11 was based on HIV positive mother. So mother is HIV positive. Mother is HIV positive. Yes, mother is HIV positive and she is not taking any antiretroviral drug. So she is not taking any antiretroviral drug. Now, which regimen is given to neonates? So please remember, when the mother is HIV positive and the neonate is born to this mother, there are two conditions. If the mother is on antiretroviral therapy, then the risk of vertical transmission is low. When the risk of vertical transmission is low, the baby will only get nevirapine. So baby will only get nevirapine for 6 weeks. Baby will get nevirapine for 6 weeks, and if baby will have the problem with nevirapine, he can have zidovudine. So zidovudine can be given for 6 weeks over here. So zidovudine can be given for 6 weeks and nevirapine can be given for 6 weeks. The best is nevirapine. Now, if the mother is not on antiretroviral therapy, so here the risk of acquiring the infection is more. Here the risk of acquiring the infection is more. When the risk of acquiring the infection is more, now there are two options over here. The baby is exclusively breastfed or baby is not exclusively breastfeeding. So baby is not exclusively breastfed or baby is exclusively breastfed. The baby is exclusively breastfed. Now here the risk of getting the infection from mother is very high. So here you will give both medicines together. Here you will give nevirapine plus zidovudine together. So here you will give nevirapine and zidovudine together for 12 weeks. So here you give nevirapine plus zidovudine together for 12 weeks, right? So just remember NZ, New Zealand, right? And exclusive breastfeeding is not there. The baby is not on exclusive breastfeeding. You will again give nevirapine plus zidovudine, but only for 6 weeks. So the baby is not exclusively breastfed. Then the risk of acquiring the infection is low. You will give medicines only for 6 weeks. But when the baby is exclusively breastfed, we will give the medicines for 12 weeks. So this is the regimen that we follow. So in this MCQ, they have asked the mother is HIV positive and which drugs are given to baby. So answer is C. So nevirapine plus zidovudine given together for 6 weeks. The history of exclusive breastfeeding is not there. And when the history of exclusive breastfeeding is not there, so we cannot say we are giving it for 6 weeks and 12 weeks. Both options would be correct. But here there is no option of 12 weeks. So answer is C. You have to mark. So question number 11, answer is C. So let's move on to question number 12. In question number 12, there was an image given regarding CMV retinitis. There is an image regarding the CMV retinitis given to you and they've asked you the drug of choice for that. So please remember guys, CMV retinitis, the drug of choice. What is the image? Image will be discussed in your OPTHA discussion. So they have asked the drug of choice for CMV retinitis. Answer is ganciclovir, right? So ganciclovir is the drug of choice, right? So guys, please remember in HIV positive patient, when the CD4 count will start declining 200, when the CD4 count start declining 200, the risk of CMV retinitis will increase. The risk of CMV retinitis will increase. And when the risk of CMV retinitis will increase, we have to give its prophylaxis. And nowadays prophylaxis is given by oral route. And the drug which is given by oral route, drug name is valganciclovir. So drug is valganciclovir. So valganciclovir is given by the oral route. But if the patient has already developed the infection, so they have shown you one image. They have shown you one image where the patient has already got the problem. So when the patient has already got the problem, now you have to give the medicine by IV route. And the drug which is given by IV route is ganciclovir. So ganciclovir is given for the patients who have already got the infection. And valganciclovir is given for prophylaxis by oral route. Now in this MCQ guys, please remember, tenofovir is a drug that is given in refractory cases of CMV retinitis. So tenofovir is a drug that is given for refractory cases of CMV retinitis. So CMV retinitis refractory case, we can use the medicine tenofovir. And acyclovir and valacyclovir. Acyclovir, valacyclovir, they are given for HSV1 and HSV2 virus. So valacyclovir and acyclovir, they are meant for HSV1 and 2. They are not meant for CMV retinitis. So in CMV retinitis, the best medicine here is ganciclovir, you will mark. So question 12, answer is A. Now question number 13, there was a one rare neuropathic disorder which is given to you. It's a rare disorder. So it's a rare neuralgic disorder. So rare neuralgia. So rare neuralgia, we call it thalamic Digeron-Rosary syndrome. So thalamic Digeron-Rosary syndrome. So thalamic Digeron-Rosary syndrome, which drug is not used? So it's a kind of a neuropathic syndrome. The patient will have neuropathic pain. So here basically, like, if instead of looking at the syndrome which they have asked, just think about that which medicines are given for neuropathic pain. So here you have to find out which medicines are given for the neuropathic pain. So here there are three medicines which are given to you, which are given for neuropathic pain. One is pregabalin, carbamazepine, gabapentin. So these medicines are the three drugs which are given for neuropathic pain. So these are the three medicines which are given for neuropathic pain. So whatever is the fourth option would be the answer. So according to some students, there is some analgesic name was given, and which is that analgesic? This is not known. So NSAID analgesic maybe was given. So there is given, they have given one NSAID analgesic. So this was the answer. So three medicines which are given for neuropathic syndrome: pregabalin, gabapentin, carbamazepine. Right. So guys, for the further discussion, I would say carbamazepine is also given for trigeminal neuralgia. So carbamazepine is also given for trigeminal neuralgia as a drug of choice. It's a drug of choice for trigeminal neuralgia, best medicine for trigeminal neuralgia. And pregabalin and gabapentin. Pregabalin and gabapentin, these medicines are given for diabetic neuralgia. So these medicines are also given for the treatment of diabetic neuralgia. So these medicines are the drugs for neuropathic pain. So question number 13, answer is D, Delhi. Rest of the medicines are given for neuropathic pain. Let's move on to question number 14. Now I'm not sure about this question, whether this question was actually asked or not. So according to some students, they have given a case of depression. They have given a case of depression and they said that SSRIs are useful. SSRIs are useful for the treatment of depression, but which is not a SSRI out of these? So they've asked which medicine is not a SSRI out of these. So please remember Trazodone. Trazodone is not an SSRI drug. Fluoxetine is SSRI, sertraline is SSRI, escitalopram is also SSRI. So these three medicines are SSRIs, but Trazodone is not a drug which is SSRI. This medicine belongs to a new class of antidepressant. We call it serotonin modulators. So we call it serotonin modulators. So this question is asked this time in your INICET exam also. So Trazodone is asked in your INICET exam also. This medicine is a serotonin modulator, and one of the important side effect of this medicine is priapism. One of the important side effect of this medicine is priapism. So priapism is important side effect of Trazodone. So in this year in INICET exam, they asked this question on Trazodone. Okay, doctor, according to Dr. Paul, this question was incorrect. Okay, I agree, Dr. Paul. I already told you in starting. This question I'm a bit doubtful. So, Dr. Paul, can you please tell me what is the exact question and what are the various options so that we will discuss over here. We'll discuss among each other and we'll able to find out the best answer. We'll able to find out the best answer out of all. So, Dr. Paul, I'm waiting for your reply. If this was not the exact question, what was the exact question they have asked you, right? Okay, now let's move on to the next question. A patient who has come to you with very high blood pressure. So patient has come to you with very high blood pressure. So blood pressure is more than 200 millimeter mercury, and patient has intracranial bleed. So patient has intracranial bleed on the CT scan. Now which drug should not be used? So which medicine should not be used over here? So which medicine should not be used over here? So answer is fibrinolytic drugs. So fibrinolytic drugs are also known as thrombolytic drugs. So these medicines are thrombolytics and fibrinolytics. So these medicines can dissolve the clot. So these medicines have tendency to dissolve the clot. So these medicines can dissolve the clot. They are actually the activator of tissue plasminogen. So they are the activator of tissue plasminogen. They are the activator of TPA. They can dissolve the clot. So fibrinolytic medicines can dissolve the clot, right? So these medicines should not be given in a patient who is already bleeding. So any patient who is already bleeding, we should not use fibrinolytic medicines in those patients. Now, whenever the fibrinolytic drugs toxicity occurs, like imagine the patient has got fibrinolytic medicines toxicity, TPA drugs toxicity. Now here we have to give some antidote. So tranexamic acid can be used as an antidote. So this can be used as an antidote of fibrinolytic medicine given in this MCQ. So in this MCQ, tranexamic acid is given as an antidote. So question 15, answer is A. Fibrinolytic drugs contraindicated when the patient has neurological bleed or CNS bleed. Now question number 16. If we talk about question number 16, a patient who is a thalassemia patient. So I think there was a case of thalassemia. So there was a thalassemia patient who has come to you, with the iron overloading. So there was a question based on thalassemia. So patient is thalassemia patient, and patient has iron overloading, and because of iron overloading, they asked which drug can be given by oral route. So they asked which medicine can be given by oral route in thalassemia. So this topic we have covered in our review lecture also. I told you that iron chelating agents are very important topic. So whenever there is a iron overloading, if the patient is symptomatic, we have to give medicine by IV route. The medicine is deferoxamine. So deferoxamine is a medicine that is given by oral route. But if the patient is asymptomatic, medicine need to be given by oral route. Now in this MCQ, according to students, the question was based on oral drug. So according to students, the question was based on oral drugs. They asked the oral drug, and the medicine given was deferasirox. So deferasirox is a medicine that is given by oral route. One more drug is deferipone. So deferipone, deferasirox are two medicines which we can give to a patient by oral route. So in this MCQ, the answer which is asked by oral route is deferasirox. So deferasirox was the answer. So question was based on some thalassemia patient. So thalassemia patients are those patients, guys, who get a regular blood transfusion. And because of regular blood transfusion, these patients will have the iron overloading. So this question is not the exact question they asked. So I just got a feedback from a student while taking this lecture. This question was based on a thalassemia patient. It was not based on iron toxicity. So this is an iron overloading case. The patient was thalassemia patient getting regular blood transfusion, and because of blood transfusion, patient has got iron overloading. They asked the antidote given by oral route. So deferasirox given by oral route, and deferoxamine or deferoxamine, same thing. They are given by IV route. So question 16, answer is A. Now question 17, patient has consumed 2 bottles of local alcohol. So patient has consumed 2 bottles of local alcohol, and now the patient has got the methanol toxicity. So blood vision typically suggests you methanol toxicity. So patient has consumed some local alcohol, and local alcohol is adulterated with methanol. So basically the alcohol is ethanol, ethyl alcohol is ethanol that we consume, but if it is mixed with methanol, then there is a problem. So methanol toxicity will occur, and they ask the antidote of choice. So the antidote of choice in this case is, like in this MCQ, if these are the 4 options, answer was ethanol. So for methanol toxicity, the best antidote is fomepizole. So fomepizole is the best antidote. So according to some students, fomepizole was there. Fomepizole was there in the MCQ. So if the fomepizole was there, it was the answer. If fomepizole is not given, then ethanol will be the answer. So ethanol means ethyl alcohol. So if the fomepizole is given, the answer is fomepizole. If it is not given in MCQ, the answer will be ethanol here. So first drug of choice for methanol toxicity is omeprazole. The second is ethanol, and both medicines are inhibitor of an enzyme known as alcohol dehydrogenase enzyme. So both medicines are alcohol dehydrogenase enzyme inhibitor. So both medicines inhibitor of alcohol dehydrogenase enzyme can be given as an antidote of methanol toxicity where the alcohol is mixed with methanol. So question number 17 answer is A, if the options are these four. If the options are having the word fomeprazole, because as per some students, instead of flumazenil, in this MCQ, the question was on fomeprazole. So fomeprazole is there, answer will be fomeprazole. So let's move on to question number 18. Now, four friends have gone to some hill station, that is Ladakh. Now, these patients have got high altitude sickness. So, these patients have got high altitude sickness. Now, this time they have asked you the drug of choice for high altitude sickness. So, guys, please remember high altitude sickness, the best medicine is acetazolamide. So, acetazolamide is the best medicine for high altitude sickness. So, high altitude sickness, the best medicine is acetazolamide. So acetazolamide is the best medicine for high altitude sickness. But the question is asked on motion sickness. If the question is asked on motion sickness, guys, please remember for motion sickness, the best medicine is scopolamine. So in this MCQ, the second drug scopolamine is given, which is also known as hyoscine. So it's the best medicine for motion sickness. It's the best medicine for motion sickness. If it is not given to in MCQ, you can mark promethazine. So they have also given promethazine this time. I don't know why they have confused you so much. So scopolamine and promethazine, they are given for motion sickness. They are given for motion sickness, right? They are given for motion sickness. And the question was based on high altitude sickness. So high altitude sickness, acetazolamide. Motion sickness, scopolamine, promethazine. And number three, if the patient has got morning sickness. So one more sickness is morning sickness. So morning sickness occurs in pregnancy. Here the medicine of choice is doxylamine. Here the medicine of choice is doxylamine given in combination with vitamin B6. So for morning sickness that is seen in pregnant female, best is doxylamine given with vitamin B6. So morning sickness, doxylamine plus vitamin B6. Motion sickness, scopolamine plus promethazine, or scopolamine followed by promethazine. High altitude sickness, so patients have reached the high hill station. Here, if you see, patients have already reached the hill station. During their stay, they have got the symptoms. It's a high altitude sickness. But during journey, if they get the symptom, it is a motion sickness. So after reaching there, they have getting the symptoms because of hypoxia. So acetazolamide is a drug of choice. Now let's move on to question number 19. So question number 19 is based on side effects of lithium. So they have asked all of the following are the side effect of lithium except, so which is not a side effect of lithium. So answer is tardive dyskinesia. So tardive dyskinesia is not a side effect of lithium. This is a side effect of antipsychotic drugs. So this is the side effect of antipsychotic drugs. Now guys, I would like to highlight over one thing over here. The thing is this 1 year. So they have given the duration. So I'm not 100% sure these options were there or not there. But I would like to say one thing. Whenever the patient will have the lithium side effects, so lithium side effects we can divide into categories: early side effects and the late side effects. So in late side effect, patient usually have CNS or the nerves problem. So patient usually have CNS symptoms. But in early side effect, patient usually have peripheral symptoms. So in early side effect, patient usually have peripheral symptoms. In late side effects, patient will have CNS symptom. So I hope tardive dyskinesia is there. If tardive dyskinesia is there in the MCQ, then the answer is clear cut, answer is D. But if tardive dyskinesia is not there in the MCQ, then I would say tremors is a CNS problem. Tremor is a CNS problem, and these two are peripheral problems. These two are peripheral symptoms. So according to that, you can mark the best answer. So if the question is having these four options, the best is D Delhi, tardive dyskinesia. And this question is based on lithium side effects. And guys, what are the side effects of lithium? So this we have discussed so many times during our lecture. So this lithium can cause increase in leukocyte count. So, right? So lithium can cause increase in leukocyte count. So Li stands for increased leukocyte. T stands for tremors. Now, fine tremors is the most common side effect of lithium. Fine tremors is the most common side effect of lithium. Now, H stands for hormonal problem. Lithium can cause three hormonal problems. And which hormone problem can caused by the lithium? Lithium can inhibit anti-diuretic hormone and can result in diabetes insipidus. Lithium can cause deficiency of thyroid hormone, so can result in hypothyroidism. Right? This medicine can cause excess of parathyroid hormone. So hyperparathyroidism can occur. Hyperparathyroidism will cause hypercalcemia. This will cause hypercalcemia as a side effect. Now, apart from that, this medicine can cause increase in the weight. So this medicine can increase the patient weight. This medicine can cause appearance of U wave in patient ECG. So patient can have some ECG changes. Medicine will lead to U wave in ECG. And when given to pregnant females, or we can say mother. So here the mnemonic says M, M says mother. So M means mother. When given to pregnant female, this medicine can cause Epstein's anomaly. So this medicine can cause cardiac defect. We call it Epstein's anomaly. So lithium side effects are increased leukocyte count, tremors, most common side effect. Hormonal disturbances can cause deficiency of three hormones: antidiuretic hormone, hypothyroidism, parathyroid hormone का excess. I stands for increased weight. U stands for U wave in ECG, ECG changes, and when given to mother, this will cause Epstein's anomaly. So let's talk about question number 20. So question number 20, patient is on some psychiatric medication and developed sudden hypertensive episode after taking wine. So guys, wine is again a tyramine containing food. It's also a tyramine containing food. So wine also contains tyramine, and this tyramine can also release norepinephrine. So this patient has got cheese reaction. So this patient has got cheese reaction after consuming wine with some psychiatric medication. So I told you in a previous question, there are three antidepressants. There are three antidepressants which can have this problem of cheese reaction. One is MAO inhibitor, tricyclic antidepressants, and SNRI. So all these three medicines will increase the level of norepinephrine. So along with this norepinephrine, these medicines can cause cheese reaction when taken with tyramine containing food. So here the answer is SSRIs. So SSRIs will not cause cheese reaction because they will not increase noradrenaline, they only increase serotonin. So instead of causing cheese reaction, these medicines will cause serotonin syndrome. So these medicines can result in serotonin syndrome as a side effect. So question 20, which drug is safest to use? So here the medicine which is safest to use is SSRI. But MAO inhibitor, TCA and SNRI can all these three medicines can cause this problem. But if you ask me which medicine will cause most commonly, like according to some students, the question was not on exception. They asked which drug will cause maximum. So most commonly it is seen with MAO inhibitors. So if you have to mark which drug will cause most common out of all antidepressant, answer is MAO inhibitor. So most commonly it is caused by MAO inhibitor and it is not seen with SSRI. So here the answer can be SSRI if the question is safest to use. But if the question is which drug is most unsafe to use, so most unsafe to use is MAO inhibitor. So question 20, answer is A. Now let's move on to question number 21. So they asked you the cycloplegic of choice. So cycloplegic of choice in pediatric patient is atropine. So we give atropine ointment. So according to some students, atropine ointment name was there. So cyclopentolate gel was there, atropine ointment was there. So guys, please remember the sequence of this cycloplegic drug. So atropine is strongest, followed by home atropine. So after atropine, there is home atropine. After home atropine, we have the cyclopentolate, and after cyclopentolate we have the tropicamide. So these are the four medicines which are known as mydriatics and cycloplegics. So they are the mydriatics and cycloplegics. So these medicines are strong cycloplegics. These medicines are strong cycloplegic given to pediatric patients. So they are preferred in pediatric patient, and these two are weak cycloplegics. So next two medicines are weak cycloplegic. They are given to adult patient to check the refractive error. So adult patients may we use weak cycloplegic. In children we use strong cycloplegic like atropine and homatropine. So guys, in this paper there is a full of autonomic system. Like I mean there are so many questions they have asked from autonomic nervous system. So this topic is very important for your exam. Even last year paper, the last paper of your FMG, there were many questions from this autonomic system. So question 21, answer is A. Now let's move on to question number 2. So question number 2 is again from autonomic nervous system. The question is based on elderly male having the BPH. So elderly male suffering from benign prostate hyperplasia. Now, benign prostate hyperplasia, they ask you which medicine can give you immediate relief. So in benign prostate hyperplasia, we have two group of medicines that can be given. So there is one group of medicines will help in urination. So one group of medicines will help in urination. Other group of medicines are given to reduce the prostate size. So one group of medicine is given for urination and one group of medicine is given to reduce the prostate size. So the medicines which will help in urination, these medicines will provide the fastest relief. These medicines provides the fastest relief and the drug is alpha 1 blocker. So we have a alpha 1A blocker that will provide the fastest relief. Drug is tamsulosin. So tamsulosin is the drug which will provide the fastest relief. But we have a medicine which can reduce the prostate size also. So medicines which can reduce the prostate size, they are the slow acting medicines. So these medicines are given for continuously 6 to 7 months. Medicines are given continuously for 6 months because of their slow action. So these medicines are 5-alpha reductase inhibitors. So 5-alpha reductase inhibitors, these medicines will block the testosterone synthesis. These medicines block the testosterone synthesis and reduce the size of the prostate gland. So medicines by blocking testosterone, they can reduce the size of the prostate gland. So medicine is like finasteride. So finasteride is one of the drugs that belongs to this class given for the treatment of BPH to reduce the size. Now there are two possibilities. According to some students, they have asked the question, which medicine is preferred for immediate relief? So if the question is based on immediate relief of symptoms, you have to mark alpha 1 blocker. So alpha 1 blocker will provide immediate relief of the symptoms. So alpha 1 blocker provide immediate relief. But if the question is based on, if this option was not there, like if they did not give you alpha 1 blocker as one of the option in the MCQ, if this tamsulosin is not there in the MCQ, then obviously guys the answer would be 5-alpha reductase inhibitors, right? So in this MCQ, best answer alpha 1 blocker if the same statement is asked in your question paper, right? Immediate relief given by alpha 1 blocker. But if the question is based on some other, if there is some other history and they haven't given you alpha 1 blocker as one of the option, you can go for 5-alpha reductase inhibitor as a best option. So question 22, according to me, answer is B Bombay. If the options are this and the history is this. If something else is there, answer might be L5-alpha reductase inhibitors. Now let's move on to the last question. The female who has come to you with female has postpartum hemorrhage and she has been given ergometrin. So she has been given ergometrin, but it was not able to stop the bleeding. Now which other prostaglandin can be given? So it's very easy, carboprost. So carboprost is prostaglandin F2 alpha analog. It's a carboprost, prostaglandin F2 alpha analog. This can be given for the treatment of PPH. So if question is asked on which medicines are given for PPH, which medicines are given for PPH? Drug of choice is oxytocin. So oxytocin is a drug of choice which might be given in the form of carbentocin. So oxytocin, carbentocin are the best medicines for postpartum hemorrhage. They are the best medicines for postpartum hemorrhage. Number two, we can also use a medicine like carboprost. So carboprost, which is prostaglandin F2 alpha analog, can be used. Number three, we can also use a medicine, we call it ergometrin. So methyl ergometrin is actually a drug name. So methyl ergometrin, which is an ergo derivative, this medicine will act on serotonin 2 receptor. So this medicine can be given for PPH. So these medicines are given for PPH. Now in this MCQ, oxytocin is not a prostaglandin analog, so it cannot be the answer. Answer is carboprost. Now misoprostol is a prostaglandin E1 analog. This is the prostaglandin E1 analog that we use for MTP, and dinoprostone is PGE2 analog. It's a prostaglandin E2 analog, dinoprost, that is given for cervical ripening. So this is given for cervical ripening. It is available in the form of a gel. It's a drug of choice for it's a Cerviprime gel that we give for induction of labor. So dinoprostone is given for cervical ripening. So answer is B Bombay. So question number 24. After taking some antiemetic drug, patient has got some problem of neck muscle. Patient has got dystonia of the neck muscle. Now which drug might be responsible for this? So which drug will be responsible for this dystonia of muscle? So answer is metoclopramide. So please remember, metoclopramide is dopamine 2 receptor blocker. It is a dopamine 2 receptor blocker which can cross blood-brain barrier. So this medicine can cross blood-brain barrier. It's a dopamine 2 receptor blocker, can result in extrapyramidal symptom as side effect, can result in body movement disorders, can result in extrapyramidal symptoms as side effect. So metoclopramide is a medicine which can cause this problem. This question is asked so many times before also. There is a other drug belong to the same class, which is dopamine blocker, domperidone. Now, domperidone will not cause this problem. So, domperidone will not cause this problem, but metoclopramide will cause this problem. Now, according to some students, there was one more question on anaphylaxis. So, according to some students, there was a question on anaphylaxis also. So, in anaphylaxis, guys, please remember, adrenaline is a drug of choice. So, anaphylaxis, adrenaline is a drug of choice which is given. So, 0.5 milligram of adrenaline given by intramuscular route, the concentration is 1:1000. So 0.5 milligram adrenaline given for anaphylactic shock. After taking some drug, patient got problem of anaphylaxis, and we can give adrenaline 0.5 milligram by intramuscular route, concentration 1:1000. So these are the 25 question list that I have able to gather after discussion with so many students regarding the questions which are asked in your FMG exam. So overall the paper level is medium. It's not very difficult. Most of the questions are from the standard topics or maybe from our national programs like HIV they have asked, TB they have asked. So most of the questions, STD program, like they have asked the bacterial vaginosis. So most of the questions are from the PSM program. So ANS is maximally asked. So ANS is a topic they have asked maximally in this paper. Plus they have asked the national programs. So national programs topic they have asked the treatment under national program they have asked very commonly. So guys, we have discussed these questions, and in case you have other options in your mind, if you think any of the question is not asked, please message me on this number. So I am always available with you to answer your queries. So any kind of WhatsApp query, I will definitely answer, right? And for the PDF of this class, like whatever we have discussed, if you want a PDF of this class, please message me on this number. I will share the PDF with you on the WhatsApp or maybe on the Telegram. So I'm also there on a Telegram group, right? So on Telegram group, my Telegram is Dr. Saurabh Bhatia Pharmacology. So Dr. Saurabh Bhatia Pharmacology is my Telegram address. So in case you want to join my group, I'll share this PDF over there also, right? Plus I will be there with you on this eGurukul Telegram group as well as on the Facebook group. So in case you have any query, guys, please tag me and I'll definitely answer your queries. So guys, if you have done well, lot of congratulations, you are going to clear the exam. We'll meet in for the PG entrance. And in case you are not being able to give the exam properly, or maybe you were not eligible for this time for this exam, so my all wishes are with you. We will be again catch up each other for the preparation of the November or December FMG exam. Guys, take care of yourself. A very good night, and now enjoy your life. The time has come to enjoy. Take care of yourself.